Hey guys, I wanted to start trying to do something a little different, just to share some case studies, some information about chiropractic health that I think y'all might be interested in. But in particular, I love sharing some of the studies and things that I come across, and I don't get much of a chance going back and forth with patients. Just isn't the time, so I thought I'd give this a go and see if there's something to be done that might benefit y'all. So I got some case studies here. As some of y'all know, I do upper cervical chiropractic. It's just a particular technique that focuses quite a bit on the upper cervical area of the spine. Any chiropractor knows that's an important area, and many of us focus on that, and all of us adjust the area, and it's because it's important. So I have some case studies here. Just listen to some of these titles. Improvement in posture, balance, and gait in a child with autism spectrum disorder following Grostic upper cervical care. Resolution of symptoms from Arnold-Chiari malformation in a 6-year-old male following reduction of vertebral subluxation with knee, chest, upper cervical care. Another one here. Resolution of symptoms in a patient suffering from Meniere's disease following upper cervical chiropractic care. And get this. Resolution of anxiety, depression, insomnia, scoliosis, and cluster headaches in a patient with opioid addiction undergoing chiropractic care to reduce subluxations. So, what's the common denominator? Correcting subluxations, a lot of different problems. That's what it is we do, is a correction of those subluxations. So, I came across some summaries of research as to why that upper cervical area is so important. This is what I'm going by. This particular study was called The Role of the Craniocervical Junction in Cranial Spinal Hydrodynamics and Neurodegenerative Conditions. Pretty fancy stuff. Basically just talking about how degenerative neurologic conditions, the nasty things, ALS, multiple sclerosis, you name it, Alzheimer's, how those things are likely affected and related to this upper cervical area. And so what they get at is, this is a quote, a misalignment between the atlas and occiput could compromise the venous drainage of the brain, okay, up and down here. It could compromise the flow of cerebral spinal fluid and or arterial supply. Trying to keep this short. So it's a potential choke point for cranial spinal hydrodynamics and may play a causative or contributory role in the pathogenesis and progression of neurodegenerative diseases such as Alzheimer's, Parkinson's, MS, ALS, as well as many other neurologic conditions like hydrocephalus, idiopathic intracranial hypertension, migraine, seizures, silent strokes, active disorders, schizophrenia, and psychosis. So that's a lot, maybe even hard to believe. But you can imagine if your brain isn't getting the right nourishment from blood or cerebral spinal fluid, it's going to start to break down. And so this is why for decades and decades, if you look and talk to enough people about chiropractic, you'll hear some amazing stories about conditions or symptoms that folks recover from. Well, it's not that we've ever treated and cured Alzheimer's or vertigo or take your pick, like I was just saying here, ALS. We're correcting subluxations. But if it's being caused by an upper cervical subluxation, folks may manifest symptoms that you can't tell the difference, or what may have been actually creating the sclerotic changes in the neurology, in the central nervous system. Another amazing quote from this study. faulty craniospinal hydrodynamics may also play a role in neurodegenerative diseases such as Alzheimer's, Parkinson's, multiple sclerosis. Malformations and misalignments there cause strains and deformation on the dura mater and suboccipital cavernous sinus, which can affect circulatory pathways and blood flow in the brain. Some fancy words, but the idea is misalignments here affect fluid flow. So spondylosis, stenosis, and scoliosis of the lower spine, that's basically degenerative changes to the bones, cause deformation of the epidural space of the spinal canal, as well as deformation of the dura mater, which can similarly affect blood flow. So when we have subluxations in the low back, it can have impact all up and down the central nervous system. So hopefully all these big words haven't been too over the top. But what I wanted to drive home was some ways that subluxations have been causing problems in neurology, of course, since humanity started. That sounds kind of ridiculous, but chiropractors have been claiming to help folks with a wide variety of symptoms, and now we're starting to see why it is that this has helped. We've had our ideas before, and of course they weren't by any means all wrong. They're part of the picture, but now we're getting a fuller picture. So please share this with folks that are asking, particularly you guys that are getting upper cervical care here, and friends or family may not know exactly why on earth you're doing that and how it could be helping. And on an unrelated note, remember to share this stuff if you want. We have the office competition going for raffles, sharing these things on your social media, leaving reviews, all this stuff will get you in the contest, and you can win fun stuff from the office. Hope this has been helpful, and I promise I'll do better with this in the future. Take care.